Welcome to Dog Training Bytes. The show where canine professionals share their key takeaways, big aha moments, and hardest lessons learned from working with dogs. I'm Mattison, certified dog trainer and behavior consultant, and dogs are my life. Every day I get to coach guardians and other trainers into a deeper understanding of canine behavior. But let's face it, sometimes dog training really bites. And that's okay, because when it does, we learn a lot. This podcast is all about sharing the lessons learned from experience, because the stories of when it got tough or when we made a mistake, that's when we learn the lessons worth learning. And it's time we share those with the world. I'll be talking to dog trainers and other pet professionals about times that working with dogs, well, bit. Not literally. Maybe literally. What's most important here on this show, what did they walk away with? What did they learn? How did it shape their approach today? Welcome to Dog Training Bytes, the show where pet professionals share personal lessons that you won't find in any textbook. Today, I'm speaking with Vanessa Ward, aka the Pet Behaviorist. Vanessa is a qualified dog, cat, and rabbit behavioral practitioner. She studied zoology, ethology, and companion animal behavior and welfare. Vanessa offers behavioral consultations, classes, and one-to-one training online and in person in South Wales. She specializes in dog behavior, cat toileting, and rabbit welfare, and her goal is for people to live in harmony with their pets. Hi, Vanessa. I am so excited to have you here.
Hello, thank you so much for having me.
The first rabbit trainer to be on the podcast, I will say.
Yes,
Honestly, the first rabbit trainer I've met, I have to admit.
I'm happy to hear that. There's not many of us out there.
This is a little known fact about me, but pre-dog, pre any dog in my life, I was a crazy rabbit lady. I had two bunnies and I built them this giant cardboard castle out of 5 moving boxes, and I had pictures of them all over my cubicle at work, and people thought I was weird.
You just described my life as well. Yeah, before
Yes.
dogs, rabbits, building things. Yeah, totally.
I think I got very lucky. I got a very cool rabbit, 2.5 pounds. His name was Jasper. He had upright ears. He was all black, and he would just chill in my hoodie pocket and fall asleep on my shoulder. And he was just, I got him when I was just about to graduate university. And he was just, I remember my parents saying, "You got a rabbit? They're not even just like a gerbil." Mind you, the next time I came home, I catch my dad taking a nap on the sofa with the rabbit curled up on his chest. I'm like, "I told you they're awesome."
The amount of times I go, oh, they're like dogs. They're like friendly and have personalities. Yes, huge ones. Too big, if anything.
They are so much fun, though. Do you have any personal rabbits right now?
No, we lost our last rabbit. When was it? End of last year, and he was 10 years old. He was a
I'm
legend.
so
He's
sorry,
lived
but
a
but
legend,
what a
right?
life. Oh
Yeah.
my goodness. I'm curious to hear about, do you have any personal dogs right now?
Yes, I have Baby Bear, who's not a baby, but he's a bulldog. So I think he's always going to look like a baby.
Permanent babies.
Permanent baby, yeah. He's actually 8 now, I think. So quite an old boy. He's got a multitude of health problems being a bulldog.
Yeah.
I do want him to wear a vest that says, don't agree with this, but rescued one, sort of thing. Just seeing all the health problems he has because of his breeding is not nice, but we manage it. He has like nearly fortnightly hydro, 2 lots of monthly injections, this, that, and the other. Yeah, it's nearly a full-time job caring for him,
Oh gosh. I'm so sorry. That does sound like a lot.
but he's fab. I don't begrudge it at all.
Baby bear. What's the name from?
We just call him Bear, but he's just a baby bear all the
He's
time.
just a baby bear. Oh my
Yeah.
gosh, I love it. I want to hear, I know this is not part of it. Forgive me for already going off script, but I just want to hear a little bit more about what got you into, what is the transition from crazy rabbit lady to rabbit trainer and rabbit behavior? I never would have known that was a thing when I was just the crazy rabbit lady.
How I don't think I did at the time either. It was the university course that I did was companion animal behavior and welfare, dogs, cats, and then you could pick horses or rabbits. And I was like, I've got rabbits, I'll do rabbits.
Yeah, horses are a little bit more expensive.
Yeah, yeah.
Just a bit. Vanessa, I am excited to hear the story that you brought for us today.
Yes. So it was so we've got Baby Bear. We used to have another dog called Misha. Misha was our first dog, my first dog as well. And we got her from a rescue center, and she was like just wonderful. She was a bit dog reactive, manageable. I was learning at the time, I was studying. So she was like my project sort of thing.
Right, right.
I'd have a lecture, read some white papers, and be like, oh, we'll work on that kind of thing. And I got her reactivity to the point where she'd see a dog and look at me for a treat, fine. And then Baby Bear came into our life, a failed foster. He was in the centre. No one was like wanting
Tale as
him.
old as time.
Yeah,
The
right.
failed
Can you have
foster.
him temporarily? And because she was dog reactive, we were like, we'll try it. And they got on like a house on fire. Best friends.
Amazing.
Absolutely best friends.
So good for
And
both of them.
yeah, and she was never going to have another dog friend apart from
Right.
one like him sort of thing. So that all worked out until it just didn't. And funnily enough, it wasn't her, it was him, the
Mm,
dog friendly Baby Bear. He got a lot of health problems all of a sudden. He got allergies. And if you've ever had hay fever or allergies, you know how miserable it makes you. And his eyes, his ears, his paws, everything. His digestion as well, it
mhm.
affected his digestion. So the
Yeah,
poor guy was just miserable. And he
yeah.
started resource guarding us from her.
Mm,
So all of a sudden it was like, okay, this isn't a peaceful household. They're not getting on well. Totally feel sorry for him because he's miserable and we're going to the vets all the time trying to get on top of that. But then you come home and it's just stress,
yeah,
just complete stress. And it wasn't all the time, it was just occasionally, but you're on the edge of your seat the whole time, making sure they're okay and they're okay in the same room, this sort of thing. It was during the pandemic as well.
hmm. So
So
we
just
are home. We are home.
there's no, oh, I'll go away with this one for a bit. Yeah, we are at home.
Yeah.
And it just gave me a real understanding of A, how much like pain and medical issues can affect behavior, because you learn about it, but seeing it, he like changed.
Yeah.
And B, how stressful it can be when you're not living in harmony with your pet.
Yeah. So what was the management that because again, in a pandemic, having two dogs all of a sudden start experiencing conflict, management is critical at that point. So what did that sort of emergency management plan look like?
There was a lot of separation and a lot of on leads in the house. You just have to work out what works for you, I believe,
Mhm.
because they were both quite chill. They both like to sleep a lot. It was reasonably okay to be like, we're on the sofa. They're
Yeah.
both under control, sort of thing. They're both on lead. Fine, we can watch a movie. It's all chill for the whole evening, kind of thing.
Mhm.
Whereas I understand for other people that may not be the case, but just those instances where it wasn't okay, conflicting instances, you're like, we need to manage this. So yeah, lots of leads, lots of separate time, lots of you have for this one, I'll have this one.
It sounds like there was not a need at that point for two forms of management, which it wasn't quite at that point. So you were able to be in the same room with them on lead and not also have to have a gate between them, for example, or have a muzzle on one of them. And I think that that's important to talk about after an instance of conflict where you're sharing a home, of separation without isolation, right? Not
That's
like
a really good way
completely
of putting it.
isolating them from each other, because if they never if after that instance a month goes by and they're not allowed to see each other, I think that can be like more harmful than helpful.
I agree, and it would obviously depend on the individuals, but they would miss each
Absolutely.
other.
Yeah,
They would
yeah.
like wanting to be around each other, but obviously he was also feeling incredibly miserable and just wanted to
Yeah.
protect his resources.
Did you notice during that time when he was experiencing the physical discomfort, in addition to the resource guarding, because that's a specific behavioral kind of outlet of what he was feeling, did you notice just like a general tension? Was he just like grumpy and cranky? I would be. Was there, other than that specific thing, was there just a high level shift that you saw?
Totally. But, and I think this is important when you're a practitioner working with people, you focus on the most painful. But yes, he was more sensitive to noises. He went from loving his crate to hating his crate. He didn't want to be shut away from us. He got FOMO about being shut away from us. And yeah, there's so many other things. Like you said, just a huge behavior shift.
When I'm not feeling well, I am emotionally needy. So I get that.
Just when
Baby
I'm
bear
hungry.
after my own heart. Did you notice any changes in his appetite?
I think at the time we were trying everything. So it was like, let's try changing his food in the
Yeah.
correct way. But I think there was just a lot of changes happening and a lot going on. No, I don't remember noticing anything anyway.
And so this happened at the time that you were in school?
This I had finished
Okay. Just
just
finished.
finished. Yeah.
Says, here's your final exam.
Yeah,
Here's your
literally. Yeah.
dissertation. So, what were the steps moving forward from that? Because I know I'm just going to speak for myself. It can be almost like a double-edged sword, or I don't know that's the right phrase, but we want to have these examples and stories and personal experiences to be able to help people and say, I've been there. But as a professional, it also can be hard, I think, to actively be living in my dog is really struggling with this. We are in crisis. We are having this issue. I've certainly had like little bursts of shame and just like not feeling great about myself because my dog isn't my personal dog is having trouble with this, or we're still working on cooperative care. So I think it's both good because we have this experience, but it's also difficult because we feel like we have to be the professionals and we have to get it all together and have it all together, but we have to have gone through it to have those stories. So I just want to acknowledge that.
Totally. My husband went through it very differently to I did. There's a curse in knowing what no, and I totally think it's harder when it's your own. And they say it for doctors and lawyers, don't they? And this is different, but
Right.
totally, I just couldn't see it in the same way. And then, like you said, there's shame, there's imposter syndrome, there's all of this extra stuff
Yeah.
piled on to an already stressful situation.
Even though, like, I don't think that guardians out there see it that way, right? I think that they see it as, wow, like they've been there, they get it. And then we can truly empathize and not just, I know it must feel this way. No, you actually know what it feels like. But again, just want to acknowledge what it can feel like when you're in that. And I know that you're not currently in that, but it is a blessing that also comes with the curse.
It's given me a real understanding of what it can be like living in that situation and the intricacies of reaching out for help and inviting someone into your house and just coughing up, I'm not coping with my pet. It's not good. I'm not coping. On some days, I don't even like them right now. Thing.
Yeah,
And that's okay. That's totally fine. It's human. That's allowed. But now I'm out of it. I can look back and be like, oh, funny. But at the time, we
right.
reached out for help from other professionals and there was shame mixed up in that. But if you'd said it to me, I'd be like, do it. Do it. What are you waiting
Right.
for? You don't
Yeah.
have to fix your own. That's fine.
Yeah. And I think that, again, just being a human who has been there means that you can identify those emotions. And I think there are a lot of folks out there with dogs with complex behaviors who, if they're really honest with themselves, they're going to be saying those things. Sometimes I really don't like my dog. I really regret getting this dog. Those things that are not better off left unsaid. Being able to give the space and make space for our clients to be able to just get it out there and let go of that because you didn't stay there. You didn't feel that way forever. But if you stuffed it and you had a professional devalidate that, that would have been a very different process for you moving forward.
Right? Yeah, totally. And it does get better. In most situations, it does get better. But the feelings that you have during it are very valid, and you're allowed to feel frustrated and you're allowed to say that. And I think it's good to say it, get it out. And yeah, it totally gave me understanding of like how difficult it can be to reach out and say all your problems to someone, a stranger who is asking what can be weird questions, because for us it links up as to how often they go to the toilet, sort of thing. But
Yeah.
you're like, my dogs are fighting. Why are you asking about this sort of thing?
I think it's such a good point that you made that it was a very different experience for you than for your husband, right? Just as a non-pet professional, it is very different. Is there anything that you, I don't know, remember or that stands out specifically from being a professional who hired a professional? Because again, I think that's not something that's talked about a lot. And we were talking about that. This is all about shining the light on the things that we don't talk about. So I'm just curious if there's kind of anything that stands out from that experience or that you feel left a mark on you.
If it was to happen again now, if Bear had some problems, or even another client that I was helping, if they gave me permission, had some problems that I was like, I just need to talk to someone else about this. Now I wouldn't hesitate. Now I'd reach out straight away and there wouldn't be any other emotions other than can you assist me with this, especially if it was my own pet. But that change from being like, oh, I should be able to do this to no, everyone needs help. It doesn't make me any worse at my job at all. At
And
all.
collaborations, professionals love to collaborate.
Right?
And it's, I think, now more maybe like an exciting opportunity to get to learn a different perspective. I think I'll probably be bringing on a professional to help with some physio training for my dog. Not my area. I don't know it. Do I really want to pivot into that as a professional and maybe take away from the work that I'm doing in the realm of behavior? No, I don't. So I'm just going to probably hire somebody else to work with me and my dog because that's what they're focused on. So they're going to be a lot better at it than I am.
My friend calls it outsourcing, and I love it. She's get a
Exactly
plumber
what it
if you need a
is.
plumber, get therapy if you need therapy, get a pet professional if you need a pet professional. It's fine. It's just outsourcing.
It's exactly right. And I don't try and step too far outside of what I do because I believe our industry and our world, with the ability to connect the way that we do online now, I think our industry is better served by people specializing and focusing and diving in deep to an area, but then also taking that step back and having these conversations to learn from other areas. And I think you in particular have a framework that kind of highlights the value of stepping outside of the species and how much there is to be learned from other species within the animal kingdom. Did I read correctly? There was a 2-hour lecture on cod.
Yes, yes, yes.
I didn't know there was that much to learn about cod.
I didn't either. Please don't quiz me on it. It was a while ago, and I'm not sure how much attention I paid, but
I certainly
2 hour lecture
won't.
on cod.
You're not a cod trainer, so I think I can let it slide.
Thank you, thank you.
Are there any other, I don't know, lessons and things that kind of left an impact on you from that either that experience with your dogs of needing to work through a, I don't want to say a high risk, but like a moderate risk situation, right? We had some physical conflict, but then also tapping in on another professional, which is something that I just don't know that people talk about a lot.
And it was a difficult step. Honestly, it was
Yeah,
difficult, and I knew I needed help, and I was doing it despite the feelings being like, I'm not good enough, I can't do this. And like I said, it's just night and day. Now I'm like, that's hilarious. Bless you. Bless
right.
a few years ago, Vanessa, like, how sweet. I also can't stress enough how much like pain or discomfort or irritation can affect an animal and how much they can hide it. Because a lot of people, a lot of owners I work with, sorry, a lot of guardians I work with, I much prefer that word, are like, no, I don't think they're in pain. And I'm like, they could be. They could have something going on that's just making them a bit grumpy.
Yeah, and it's always worth exploring that and at least ruling some things out. I don't think we can rule everything out, but ruling some things out and getting curious about the physical condition. I think that can be just so important. I'm working with a multi-dog household right now. They're actually litter mates, and one of them has chronic ear infections. And he gets real grumpy when his ears are infected. And he just is like ready to fight when that happens, and he's just doesn't have any patience for his brother's shenanigans. And things are just very tense and on edge, and as you see the physical discomfort leave, you see the behavior change.
And they just hide it so well until they can't cope with it anymore.
Yeah,
And
until
it's
that
like, don't
bucket
do
just
that.
overflows.
Totally. And then they're just so grumpy, as you can understand that they would be, but
Right.
they can't express it other than how they would normally express, which is how dogs express things, which can involve teeth and growling.
It often does involve teeth. That's how they communicate. Vanessa, is there anything else you'd like the listeners to know about you or what you do?
Just again, if you are having problems with your pet, reach out to someone and include in that probably, depending on the individual situation, a vet or someone who look at the physical side of it more than the mental side of it.
Absolutely. And get curious. If you even suspect there could be something, get curious and ride that train all the way to the station.
I love Get Curious. Yeah, one limb. Focus on
Right.
that. Yeah.
Exactly. You can connect with Vanessa on Instagram at the Pet Behaviorist VW, and you can find more information and a link to her work in the show notes. Thanks for joining us in the world of Dog Training Bites, where every challenge brings a lesson worth sinking our teeth into. See you next time. Dog Training Bytes was created, produced, and edited by Mattison Simpson. You can connect with me on Instagram at Dog Training Bytes, that's BYTES, and at Freed by Training. For information on today's guest and resources for help with your dog or dog training education, visit www.dogtrainingbytes.stream. Looking for more? Listen to my other show, Unpacked, a clinical dog training podcast co-hosted by Sailor Jerry the Dog Trainer and produced by Straight Up Dog Talk, LLC.